I opened this hour by playing you comments over the weekend from Bill Maher, the host of Real Time on HBO, in which he said, look, we got to hold Republicans, conservatives, and liberals equally accountable for the misinformation that they spread about COVID-19 because we made it political. And he talked about specifically the fact that Democrats perceive COVID-19 to be way more dangerous than it is as far as hospitalization rate. And he said this is why, for example, in blue states, you still got kids outside of school. This is not factual. And he said, you don't want to praise Ron DeSantis of Florida because you're a liberal and he's a Republican governor, but he got it right. And Governor Cuomo of New York got it wrong. So you heard those comments early in the hour. If you missed them, you can like me on Facebook. The Facebook page is Need to Know with Jeff Angelo. And this program appears in podcast form in the afternoon. But I wanted to talk to a healthcare expert about our national conversation on this, COVID-19. Paul Seegert is back on the Newsmaker line. Paul, welcome back to Iowa Radio. Good morning.
Thank you for having me.
So, Paul, I mean, now that you step back from all this and you look at the dialogue going on about COVID-19 between conservatives and liberals, is Bill Maher right that because it became political, we got so much wrong? What do you think?
I think that's very much the point, and it's very true. I've been saying this for some months now that we are being told that we're following the science when, in fact, we're not really following the science in all respects, or not the parts that we don't want to follow, that don't fit into the conversation of the messaging that certain folks in the mainstream media and, for whatever political reasons are wanting to push. We're victims of bad messaging, and I think the real downside of it all is that we have access to information, all of us, on these smartphones we carry. So it just erodes confidence in what we're hearing.
Paul, one of the things that made me recall Bill Maher's comments is I was talking to a doctor about a month ago on the air, and he said, Jeff, we have really underplayed how to build up your immune system during this healthcare. We were talking about all the other things, whether it's lockdowns, whether it's masks or what have you. But Paul, we really did underplay that, didn't we? We didn't just tell people, here's what you do to build up your immune system.
I saw a study just this past week that said if you get COVID, or as a way of kind of protecting yourself in advance, if you were to walk briskly for 30 minutes a day, the odds of you having a severe case of COVID go way down. And one of the comments that Bill Maher made that I've been talking about on some recent interviews, the fact that this largely, it's been such a hard hit. We've been such a harder hit country because 78% of the people that have been hospitalized and or died from COVID were overweight, severely overweight, or obese. And we've got an issue with that, a real epidemic. That's a greater pandemic, really, in terms of the way that it affects our healthcare system. The total cost to our healthcare system from all of the illnesses related to our lifestyle here is a much, much greater conversation to have, and I think could be much more positive in its outcome than what we've done around COVID.
Well, and Paul, man, you went big picture there, and I appreciate that because so many people during this pandemic, so many listeners, Paul, contact me and go, this information's, it's contradicting each other. And on one hand, we talk body positivity. You don't want to fat shame, yet you and I know, I mean, it may offend people, but the statistic you just cited is true. Obesity and weight problems in this country are an overall healthcare problem, aren't they?
Absolutely. I mean, diabetes is taking more. Diabetes, smoking, excessive alcohol consumption, and being sedentary. That's killing many more Americans every year than COVID ever will. And I mean, in mass numbers, we've just kind of grown accustomed to it and seem to accept it and almost promote it. Unfortunately, because of what you pointed out, there's fear around not being politically correct and what you might suffer as a result of that. So that's, to me, is one of the biggest misses that we've had, is not focusing on our big vulnerability there and taking it as an opportunity. If the mainstream media would put half the effort into using this as an opportunity to promote a healthy lifestyle, I mean, you see the power of the media in getting people to believe things that aren't even necessarily accurate. As Bill Maher pointed out, the fear that people have around what percentage they think are hospitalized when they get COVID and how far off they are.
Yeah.
Let's get that power behind something good, like, encouraging a healthier lifestyle. Another thing that has really struck me through this whole process is that we're not talking about all the ways that we can get to herd immunity. We're pushing the vaccine.
Right.
But all the science supports the fact that we'll get to herd immunity just like we have with other diseases, either through vaccination or through getting the disease and recovering. Either way, you're getting antibodies. And as recently as last week, another study confirmed that yet again, that if you've had COVID and recovered, you have more immunity than the J&J vaccine that got paused, and a little bit less perhaps than the other two that are in use here today, currently in the U.S. So less than 1%, and it's way to the right of the decimal, the percent of people that will contract COVID twice. And so if you consider that, and the CDC's own data that says 8 times more of us have had COVID than have been confirmed with COVID, and we've confirmed 31.7 million as of this morning. So do the math. 31 times 8 is 240 million of us have had it and maybe didn't know. We're asymptomatic. You add that number to the 84 million fully vaccinated people, some of which are already had it and didn't know it as well. Either way, 270 was the first number we were given for herd immunity, 270 million. Somewhere between 270 and 300 million, 70 to 90% of the population there. Yeah. We're there. We're getting into it or have been in it. And so as we see this good news that is not really getting reported in terms of, hospitalizations declining and case counts going the right direction and everything else, if you're actually following the numbers and the science, it isn't terribly surprising.
Well, Paul, that's such a great point, because I have a text line where listeners are texting me throughout the show, and we are reporting today that we're getting to the point where you're getting to the point of 1 million Iowans vaccinated. 1 million. Our population in Iowa is over 3 million. Okay, so that's a huge number. And a texter says to me, what happens once everyone wants a vaccine, has one, and the remaining people choose not to get vaccinated? Which is true. We're not going to force people to get vaccinated. That's their own personal choice. So you have to add vaccinated people plus people who have had it to get to herd immunity, Paul. And that's an important number, because people are going to choose not to be vaccinated, and we need to respect that choice.
We've gone out and purchased, if you look at the European Union, the UK, Canada, US, if you averaged it together, we've all purchased between 4 and 6 times our population in doses of vaccine. And I mean 2 doses if needed. We've purchased massive amounts of the vaccine. So I'm sure there's some urgency then to use it. And I'm not saying that was an incorrect thing to do. There was so much success in that Operation Warp Speed, pre-buying vaccines that we didn't know if they would all work out. And it turns out we, in a way, have a glut now of vaccine. But you've got all this vaccine, and it might make sense if you were trying to get to herd immunity as quickly as possible and use the vaccine where it was needed most. It might make sense to give people an antibody test and then not vaccinate them if they've got the antibodies. Now, I sound crazy perhaps, but that would follow the science.
Well,
why not?
Following the science, Paul, last question for you, because you were bringing up the power of the national media here. And there's a writer today on Twitter. She's from New Republic. So she's on the left. And she's written an article saying, it doesn't make any sense to wear masks outdoors anymore. And going back to the Bill Maher interview, he says, you got sunshine, you got wind. She's getting furiously attacked from people for daring to say that, because she's on the left. And at some point, people on the left have to start talking to their fellow people on the left going, hey, science says it's time to start taking off some of these restrictions. But Paul, it's really going to be hard psychologically for some people, isn't it? After living this life for a year.
Well, unfortunately, we have to unravel so much fear that has been created, a lot of it unnecessarily. I'm an avid jogger. I'm going to go out and jog today in the park, and every day when I do it, there are people who literally seem offended that I'm not wearing a mask, even though I'm not at risk and I've already had COVID. So there's no need for me to wear one. It's pretty silly.
Yeah, but you're right. Power of the national media on all of this. Paul Seegert, he is a managing partner at PCS Advisers, which is an employee healthcare benefits consulting firm, which is based in Northern California. And Paul is just a guy that takes a big view of the healthcare system in general. And I really appreciate his insight this morning. Paul, thanks very much for talking with me.